Thanks very much for staying with us. Time now for Eye on Africa with me, Georgia Calvin-Smith. Tonight, an abducted Cameroonian ruling party senator appears in a video announcing her resignation and calling for Anglophone independence. Regina Mundi may have been forced to read the statement by English-speaking separatist militia who've claimed to have abducted her. Also, there are calls for the government in Congo-Brazzaville to do more to identify and support those suffering from mental illness. It's a neglected issue across the continent, and the fallout can have devastating consequences. And as Muslims across Africa mark the end of a month of Ramadan fasting, many are getting ready to celebrate 3 days of Eid al-Fitr. But the war in Ukraine sent prices spiralling and put a strain on the festival's meal preparations. We hear from our correspondents in Senegal. But first, a kidnapped Cameroonian senator has appeared in a video circulating on social media in which she's seen to be reading a statement saying that she's standing down from her role. Regina Mundi and her driver were abducted in the capital of the Northwest region over the weekend. The country's ruling party said that two wings of the Anglophone separatist militia, the Amazonian Defense Forces, or ADF, have claimed responsibility. They've frequently kidnapped civil servants in the past. Claudia Sonner tells us more.
A Cameroonian senator kidnapped over the weekend by armed English-speaking separatists in Cameroon's restive northwest region has resigned. In a video statement made from captivity, Regina Mundi also pledged her allegiance to what separatists have called the struggle for the independence of the country's two English-speaking regions. Well, the details are still sketchy, but we now know that the lawmaker and her driver were kidnapped in Bamenda on Saturday. The video appeared on social media on Sunday. In it, separatist militiamen said that they had abducted the lawmaker for questioning, saying that she'd only be freed if Cameroonian authorities release about 75 militants who've been detained since the outbreak of the bloody conflict over 4 years ago. In January, an opposition senator was shot dead by militiamen in the same city. The regional governor has now confirmed their abduction, but then the ruling party is yet to make a statement on the situation. Cameroon has been rocked by violence since October of 2017. Clashes between armed separatists and security forces in the minority English-speaking regions have left at least 5,000 people dead and displaced over 700,000.
Claudia Sonner there for us. Now, in Niger, on his second stop of his tour of West Africa, UN Secretary-General Antonio Guterres called for more international investment in the country's pushback against jihadist insurgents. Niger is part of the G5 Sahel group, which coordinates regional security cooperation, but Guterres observed that the group may have been weakened by coups in two of its member countries, Mali and Burkina Faso. In stressing that jihadist threats in the Sahel have global implications, Guterres said that Niger's army needs more equipment and training to tackle regional extremist violence and called for more humanitarian aid.
We are seeing that the level of funding towards humanitarian aid and stabilization activities has gone down. For instance, the humanitarian response program for Niger in 2022 is currently only funded at 8.7%. This is absolutely unbelievable. I call on all of our partners to make sure that our investment and involvement in the region be maintained despite the recent crisis the world is going through today.
Emergency services are still searching for survivors of a building collapse in Lagos in which at least 8 people were killed. Many others may be trapped in the rubble of the 3-story residential building that went down in the Oyingbo area late Sunday night. Around 24 people were rescued by Monday afternoon, but it's not clear how many people were inside when the site crumbled. Authorities say that the structure had been due to be demolished, but that tenants had stayed on. Russia's foreign ministers reiterated Moscow's official position on the Russian private military company Wagner Group and said that its operations in Mali and Libya are purely commercial and nothing to do with the Kremlin. Sergei Lavrov claimed that the EU and France had earlier told him that Africa was their zone of interest. Wagner Group mercenaries have been accused of abuses in both Mali and Libya. Now, across the continent, people suffering from mental illness or injury can really struggle to get the help and support that they need. The neglect of their conditions can have devastating consequences. Earlier this year in Congo-Brazzaville, the issue was brought starkly into focus after a woman suffering from dementia killed a baby. Now, that sparked more calls for the government to offer better care. Our team tells us more.
Viviane Diankolea spends most of her days looking for her nephew in the streets of Pointe-Noire, Congo's second-largest city. The young man suffers from a personality disorder and often runs away from home.
We were worried about his recurring headaches, so on the advice of a neighbor, we went to church and then to hospital. After the staff examined him and prescribed him medication, his condition improved, but he relapsed a month later.
Despite being diagnosed more than a decade ago, Viviane's nephew has never been properly monitored by a doctor. Like hundreds of mentally ill patients across the country, he receives no support from the government. Dr. Dauphin Matemolo is the only psychiatrist in Pointe-Noire. The city has been without a psychiatric ward since the 1980s.
I have no choice but to send patients home, and I do this with great sorrow, because as their doctor, I see how they behave, I see how unstable they are, how aggressive they can be, both verbally and physically. But I ask them to go home because there are no facilities to look after them.
To improve access to adequate care, the Congolese government launched a national mental health program in 2019. But 3 years on, it remains both understaffed and underfunded. The death of a baby at the end of March, torn from his mother's arms and thrown to the ground by a patient who'd never received treatment, could however give a boost to its implementation.
This tragic event has been a wake-up call for us. We want to make sure it never happens again. But to be successful, we need more support from our partners to tackle the problem of mentally ill patients wandering the streets.
The National Mental Health Programme estimates that across the country, 1,500 mentally ill patients have no access to medical care.
Well, millions of people in Burkina Faso have been forced from their homes because of years of growing extremist violence. The displacement has disrupted farming and driven hundreds of thousands to the brink of starvation. Those already vulnerable to food insecurity are now facing even more uncertainty because of the impact of the war in Ukraine. Laurent Bernstecker has more.
Martina Ruamba has been going hungry since fleeing her village last year. The young mother now lives in a makeshift camp near Burkina Faso's capital and barely produces enough breast milk to feed her infant daughter.
Jihadists came to our town and destroyed everything. That's why we came to Ouagadougou. But life is difficult here. We used to grow enough food to eat, but now we can't farm. We have to buy everything and prices are increasing.
In recent months, patients like Ruamba and her daughter have been flocking to this hospital. An ongoing jihadist insurgency has driven nearly 2 million people to flee their homes in Burkina Faso, abandoning crops and livestock to seek refuge in cities. This urban exodus has also caused commodity prices to almost double in the past year. Humanitarian organizations now warn the situation is likely to get worse if violence continues to spiral, with some 630,000 people expected to be on the brink of starvation.
The security situation is deteriorating each day. There are more and more health centers closing. Populations are in need of help. There are over 2.5 million people who need food.
Aid agencies in Burkina Faso are already critically underfunded and received less than half of the money needed last year. They fear more cuts could soon follow, as many donors have begun switching their focus to the war in Ukraine.
Well, Muslim communities around the world are getting ready to mark the end of 30 days of Ramadan fasting with celebration for Eid al-Fitr. In Senegal, that typically means families getting together around a table, and one of the go-to meals is chicken. But with the price of poultry doubling over the last few weeks, that's really put a strain on preparations, as Sam Brad-Peace tells us.
Fatou does the same thing each year. On the last day of Ramadan, she goes out to choose chickens to serve up at the family feast. This time around, she is shocked by the soaring prices.
It is truly very expensive. Chickens that are not even 2 kilos are sold at €5. I must buy 5 to satisfy the whole family. At that price, it will be very difficult to manage.
In Senegal, close to 10 million chickens are eaten during Eid. The price is set at a fixed rate by producers. The rising cost of chicken feed, much of which is imported from Europe, means that poultry prices have gone up.
1 kilo of feed used to cost 315 CFA francs. Now it costs more than 400 CFA francs. It's a very surprising increase. As farmers, we struggle. Sometimes we even sell our chickens at a loss.
An official at the business ministry blamed inflation across the country on the war in Ukraine.
The crisis in Ukraine has caught up with us, having an effect on the availability of produce. All of that creates a situation where we are seeing difficulties in terms of prices, but generally, demand follows supply during Eid.
The government has scrapped customs duties and VAT on goods like sugar, oil and rice in a bid to help Senegalese households cope with inflation.
Well, that's it for Eye on Africa for now. Thanks for joining us. Do so again. Take care.